All right, these are the supplies that you're going to need to do a reflexology treatment. The complete treatment is called a foot ritual. So we're going to start off by cleaning the feet and preparing the skin for the actual treatment. To begin, what you're going to need to do is wash your hands, then apply this product. It's DermaShield. It'll protect you from any problems that the feet may have, ringworm, athlete's foot, anything like that. Then you're going to apply a soak, and there are many different ones. This is a great product, especially if you find that they have a lot of callus on their skin. Then you're going to clean the feet and scrub the feet with a foot scrub. You want something that has pumice in it, and it can be any different aromas that you like, but you need something that has pumice. And you're going to take this product off using towels. For the service, you're going to need 4 hand towels. In the beginning, you're going to have gloves on. You're going to wear gloves to protect your hands. This is an extremely powerful product, and you don't want it on your hands. Then when we do the actual service, it's up to you whether you leave the gloves on or take them off. That's a personal preference for the therapist to make. Performing the reflexology treatment, you're going to use a powder. This is a great powder because it has a lot of properties in it that help with the electrical energy of the body. And then you're going to use warm towels again at the end when you're finished with your treatment. First thing we're going to do is put our gloves on to protect our hands. It's a very powerful cleaner. You're always going to check the feet for cuts, bruises, warts, anything that they might have going on their feet. Ask them if there's any painful areas. We're going to soften up his skin. So we're going to put this on first, especially on the heel where people have thick calluses, and the ball of the foot, not necessarily the toes or the top of the foot, because most people don't have a problem there. And we're going to put a warm towel on his feet and let that soak in. Your towel needs to be folded lengthwise. Think hot dog. It's folded like a hot dog bun. And you want the fold up. Grab it, place it, and pull a little bit to hold it in place. So it's lengthwise, fold side up, give it a little tug so it can hold to the foot, and let it soak. At this point, you can do a little compressions for the person, open up the metatarsals a little bit. Most people wear shoes that are much too tight. And take the towels off. Next, we're going to scrub the feet. Remember, this is a scrub, this is not a massage, so you're not going to do all these fancy moves with your hands. You're simply going to remove the dead skin. The heel, you can scrub a little harder because the skin is much, much thicker. But the back of the foot, the dorsum of the foot, you want to use very light pressure. And now we're going to take the product off. Hot dog fold, little tug. So we're going to very carefully remove as much of the product as we can. You're not going to be able to get every single grain off, but once the foot dries, you're going to be able to go back and brush off the remaining. Be sure you get between those little toes. Now, I like to remove my gloves. It's easier for me to know what I'm working on and what I'm touching. And now that his foot has dried, I can come back and remove anything else that may still be there. Now we're going to use the powder. If you're going to use lotion or anything like that, you are no longer doing a reflexology treatment, you are just doing a foot massage. And feet massage are great, but in order to reflex the nervous system, you need to be able to pull the skin. And if there's lotion or oil on the feet, it's very difficult to do, if not impossible. Now, if you notice their feet begin to sweat a little bit after you put this on, add more powder. Be careful how you take the powder out of the container. You don't want to breathe this, so don't be shaking it in the air. Put it as close to your palm as possible and just put it into your palm like that to reduce the airborne particles. Before we begin, I'm going to run to just a few of the techniques that we're going to be using. In reflexology, the two main ones is what we call an inchworm or a hook and back up. And the inchworm can be done either with the thumb, the forefinger, all four fingers, a knuckle, the tall finger, whichever way that feels more comfortable to you on the particular part of the foot that you're working on. But the standard one is using your thumb. Your thumb is a compression joint. It is designed to take pressure, but only if it's lined up properly. If you're using your thumb way out here, completely abducted, you're going to injure the joint. The thumb needs to be supported. So you're going to keep your thumb close to your palm, or you're going to bring your fist around underneath that first joint, that interphalangeal joint for the thumb, and support it here. If you use your index finger, you can use it supported by your thumb. If you want to use your tall finger, it's pretty strong. It's even stronger than your thumb. You don't have the same configuration. It won't injure like your thumb will, and you could use that for almost all of your work. But if you put two of them together, you're giving that tall finger a little bit more support. If you use your knuckles, you just curl your finger over like that, and you're going to walk from the distal to the proximal like this. And I'm supporting it with my thumb. Now, the hook and back up is the opposite motion to what the inchworm does. The inchworm is taking you forward. It's stretching the skin, letting it go, and moving you forward. The hook and back up is mainly for one particular spot. You're going deeply onto one part of the foot, and it's going to be pulling the thumb over and back, over and back. For example, support is extremely important. Wherever you're working, you have to support the foot. You can't just work on it hanging in air, because then the foot moves and you're not getting any stretching into the skin. So I'm going to straighten his foot out and support it and use my index finger. Now if I'm going up here, I can just lay it down like that. And if you look closely, you'll see the skin stretching. That's your objective, to make the skin stretch as much as possible. Now if I'm going to do a hook and a back up, I really wouldn't do it up here. It's too thin, it's too fragile. But I don't know if you can, hope you can see this. This point at the base of the ball of the foot, dead set in the middle, is what we call the solar plexus. And if I want to reflex that really deeply to help my client relax, I can put one thumb or two, it doesn't matter, and dig in and pull back. Dig in and pull back. And you know you're doing it right if those toes wave at you. Dig and pull back. You of course are going to work within the client's pain tolerance. If it's extremely painful, it's not really going to be benefiting them. If you do it up here on the toe, you're going to have to support the toe. If I work on the toe, I have to support it. So wherever I'm working, I have support from the same hand or the opposite hand. If I wanted to do that hook on the big toe, I'm going to support it and dig in and bring my knuckle all the way over to where it's almost or touching the foot. So that's a hook and back up. That's an inchworm. Big difference. Everything else we do is what we call desserts. They're for loosening the foot, increasing the circulation, stimulating the lymph system. And someone had told me once there's over 150 different ways you can do this. Use your imagination. So whatever you've been taught about stretching, throw it in. Anything else that you want to do. Mainly what we do in reflexology is called side to side or shoe shine, whichever way you want to call it. But you're just going to put your hands like this and go back and forth and make the foot invert and evert, invert and evert, back and forth, back and forth. And you can let your hands travel, go down and come back up, down and come back up. So that's side to side. Hook and ankle, you're going to use the hypothenar eminence on the palm of your hand, and just like the title says, you're going to hook the ankle. So I'm going to put that right below the malleolus on the inside and the outside, so that I've made a little V with my hands, and I'm going to go back and forth, and the foot should flop side to side. Sometimes we call this windshield wiper. So if their little foot is doing a windshield wiper move, you're doing that correctly. But you have to be underneath with this part of your palm right there in order for it to work. Spinal twist, you're going to put both of your hands together and you're going to grab the instep, the arch of the foot, and it is a ringing, it's a friction, it's not sliding. So I'm going to hold on to the skin and try to move the bones in the foot. So I'm holding, no sliding, and just twist it. The arch of the foot represents the spine on the body, so we call this a spinal twist. But you see, I'm not sliding. This is called ankle rotation. Now, as with any other modality, what makes it feel good, go smoothly, have flow, is how you transition from one step to the next. So you need to know which hand goes where, and that takes practice. But if you're consistent, all of your work will have a very smooth flow to it. Every time I do this, I'm going to always grab the instep with my medial hand. I'm going to put my thumb on that solar plexus. So this hand is going to hold his foot like this. My lateral hand is going to go under the heel, and I'm holding the Achilles tendon. I've got my thumb distal to his malleolus. And I'm going to pull back a little bit. You want to put a little traction on the foot, and it's your body doing the work. It's not your shoulder muscles. So I'm going to pull back on his foot and make a circle 5 times. Then I'm going to take this hand off the ankle and place it on top of the ankle, on the top, with my thenar eminence at the base of the foot. I need something to push against. Now I'm going to push forward with the foot. Forward. And your client should feel your pressure at your thumb. The thumb is what they should feel. And do that 5 times. So that's an ankle rotation. Now this is called metatarsal kneading. You can do it a couple of different ways, but this part of the foot is usually where people have had very, very tight shoes and they've been very restricted. So we want to try to open that up as much as we can. Make a fist with your medial hand. Your lateral hand is going to be the support hand. So I'm going to push into the foot against my hand, and I'm just going to make little circular frictions. And I'm going to travel across the ball of the foot with that. And if you'll notice, my hands are going like this to make that metatarsal kneading. So that's one way to do it. Another way is called hand washing. It's very similar, but you're just going to walk the heel of your palm back and forth across his foot. So you're going to hold the ball of the foot like this with your hand, and you're just going to walk from the little toe to the big toe and back over. Just walk, walk, walk. This isn't as deep as the first one, but it really works because it's moving those bones up and down as you travel across the foot. So that's metatarsal kneading. We also do toe rotations. Remember, you never grab the toe nail in any service that you do, especially in this service, because you don't want to be the one that finds out that they've got an ingrown toenail or any problem with their toes. So we're always going to grab the base of the toe, and we're going to put a little traction on it. So I have to support my work. This is my mother hand, this is my work hand, and I'm going to grab the base of his toes, put a little traction, and just make a circle. So you can go one way 5 times, another way 5 times, and work your way across the foot. Little traction, and push-ups, you get straighten the toes out. Now you can vary that however way you like. You could add a little vibration to it, whatever you'd like to do to make that different. So if you do it 2 or 3 times in your routine, each time you do it should not be exactly like the last time that you did it. You need to add some variety to it. People enjoy that much more than if it's just like a robot did their massage. A robot didn't do their massage, an artist did their foot. Then we're going to put all that together in a routine. Now there's a couple of different ways you can stretch the foot as well, simply by holding it and pulling it down into plantar flexion or pushing it up into dorsiflexion. But see how I'm holding the foot? I've got the solar plexus and the top of his ankle. This is a great one to do. This is a lot of fun and it feels really good. We call it fat feet. I'm going to line my fingers up between each of his metatarsals and I'm going to pull them apart. So I'm going to start the big toe and work my over and maybe come back. You're going to hold the foot like this. Get into a very broad archer stance. Put your fingers there and just pull them apart. Move over, pull them apart. Move over, pull them apart. And pull them apart. And then you can work your way back. You can also curl the foot over your fingers. You can start in the middle. We call this popsicle sticks because it's like you're breaking 2 popsicle sticks apart. And just a really great way to stretch the ankle. Put their foot against your forearm, and you're not really supporting it, your hand is just there. Keep the knee straight and just rock up in a horse stance, and then rock back, and then rock up, and rock back, and rock up, and rock back. If you want to add a little more therapeutic benefit to what you're doing, you may want to add a little bit of a lymphatic technique to what you're doing. This area of the foot is called the lymph C, S-E-A. It's where it all kind of pools together to go back up the leg. And if you just do little circles on that point, 20, 30, light technique, it's just stretching the skin, you can help pull the lymph and send it back up the circulatory system and drain the foot. After you've done that, and after you've completed your routine, if you want to make sure that you get out what you just broke loose, you don't want it to settle back down in the foot, you need to pump it through the lymph nodes. They're here. I'm going to put my thumbs on the solar plexus, either over one or separate, and put fingers there on those lymph nodes. And as you dorsiflex and plantar flex the foot, you're just going to pump it. So it's going to be a pumping motion as you come forward and a pumping motion as you move back. And you're going to walk across the ankle, however many places you think you can work. And use your judgment how many times you think you need to do this. Another way to stimulate the circulation is to tapotement on the leg. So after I've done all this, I really don't want it to sit there. I do want the leg to go back to normal. So I need to get all that out. Just tapote. This is called feathering. Believe it or not, this is actually a really, really good stroke for lymphatic drainage. Feathering really helps move lymph. And then anything else that you'd like to add to your routine. I'm going to demonstrate how to do this on one foot. Just remember, you are going to do both feet. And as you can see, he's got his leg up on the leg lift, but he's put his other leg down. It's much more comfortable for the clients to do that. If he did not, I would have to move it out of the way. It's very difficult to work on a foot when the other foot is in your way. Now, some people like to go one area, one area, one area, one area. That's a little choppy. I really don't prefer to do it that way. So as I work on this foot, I'm going to get this foot out of the way. So I can either put it up like that, out of my way, or have them put it next to the leg lift on the table. Okay? Put a little more powder on there. And we're going to start with side to side. So we're going to move the foot, evert, invert, evert, invert, side to side. We're going to do a hook in ankle. Make the foot flop like windshield wipers. Now, from this step to the next one, I have to know which hand goes where. This hand is going to come up and hold his instep. This hand is going to go under the ankle. So from this move to this move, it should be smooth. It should flow from one to the next. If you stop and you can't figure out where your hands are going to go, it's not going to be a very enjoyable treatment. So I'm going to go like this, and remember, you're going to traction. So I'm going to pull back, push forward, pull, 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 pull. Move this hand to the top and push forward now. Your table and your stool adjust. There is no reason why you should be doing this or this while you're working on someone's feet. You're going to follow good body mechanics. You're going to keep your back straight, your pelvis tilted, both feet on the ground, and you're going to sky hook so that your shoulders can drop and your head can elongate. I'm going to move my stool to come over here and not my body. I'm going to do a spinal twist, back and forth, back and forth, back and forth. Work my way up and down, up and down. Now, this is called a lung press. I'm going to push into the ball of the foot right at that transverse crease to stimulate the lungs. Now, if you look at how the foot is formed, how the toes curl this way, and look at the foot, your knuckles, you want to match that curve. So it's going to be my lateral hand that I put into their lung on the diaphragm line. If I use this hand, my curve is going opposite to the way their foot is going. It doesn't match. Your tall finger knuckle stands out from the rest of your knuckles, and you're going to put that right dead center in the middle where that solar plexus is. And it's a punch. Your hand is going to go like that. It's a punch. So I'm going to push in and come back. Always support your work. You can have them breathe with you. It's much more effective if they breathe with you. So they're going to inhale and they're going to exhale. And you're going to do this 3 times. Then you're going to hold the foot and put your thumb on that solar plexus, and you're going to hook 3 times. And you want to watch the toes. They need to dance for you. And then you've done that correctly. Okay? We're going to start on the body at the head and work our way down. So when you look at a foot, it's kind of like a little holograph of the rest of the body. This is the top. This is the head part of the body. Here is the shoulder line. This is the chest area. Here's the diaphragm line. Arch of the foot is the abdominopelvic region. Spine is here, just like it's in the midline of the body. It's on the midline of the foot. Outer areas, shoulder, arm, hip, and leg. So we're going to start at the top. We're going to start on the head. Support your foot. Use your thumb. You're going to hook. The first move is a hook. If you look at the side of the big toe, you're going to see a crease at the big toe. It curves around and down, and it's right on top of this big knob to the foot. Well, just like on the body, the C7th vertebrae stands out from the rest, and that's the beginning of the neck, and that's where you're going to start, is there on the beginning of the neck at the C7 vertebrae. But we're going to start our line with the hook. Support my thumb. I'm going to hook into that point, and then I'm going to walk. Inchworm across the base of the big toe. You're going to do that 3 times. So I'm going to come back to the beginning and back to the beginning 3 times. Now, when you look at the big toe, you see the toe print swirls around, and where it comes together is a point for the pituitary, the pineal, and the hypothalamus. So we're going to stimulate that. A lot of people will find this a little painful, so work within their tolerance, but you're going to put your thumb on it and you're going to hook it. 1, 2, 3. We're going to stimulate the brain. We're going to do inchworms across the top of the head. 1, 2, 3 lines. Then we're going to rotate. So I'm going to hold the foot with my thumb on the solar plexus, kind of straighten it out a little bit, grab the base of the toes, and just circle them. Just circle them. Go back and forth, up and down, whichever way you'd like to do it. Now I'm going to walk down the plantar surface of the toes. I need to support what I'm working on, so it's kind of up to me or you how you want to do this. You can stand up, whatever you'd like to do. You just never want to bring your elbows away from your body. So if I have to start working like this, I'm doing something wrong. If I want to work all of them at once on this side of the body, it's going to be my medial hand. My medial hand. If I'm working the top of the toes, it's going to be my lateral hand. If you put both of them together, you'll know you're doing it right if this is how it looks. If I inchworm all of them together, I can hold the bottom and the top at the same time. So I'm going to bring my stool around and not do it facing the foot because I want to work down those toes. In this position, I would rather use my tall finger than my thumb, because see what I had to do to use my thumb? Tall finger, I don't have to do that to my wrist. Big toe, inch down it. Remember, you're going to do it 3 times. Now, you can inch each toe individually if you'd like, or you can do them all at once. Support them, put all 4 fingers on the base of the toes, and inchworm them down. Saves you some time to inchworm the toes. Oops. Then I'm going to do a side to side. So after I've done that area, every time you move from one area to another, you want to throw in a dessert. I could do side to side, I could do whatever I choose to do, but this is kind of a loosening movement, so we're going to do a side to side. This little area where the toes meet the foot is the shoulder line. So if I were looking at his body, the toes are everything above, and then here it would be the dividing line between the head and the chest area. So that little shelf where the toes meet the foot is your shoulder line. This is a reflex for the eyes and the ears. Remember, the foot is like your body, so these are more medial, these would be eyes. These are more lateral, they would be ears. Generally speaking, you're going to work the foot superior to inferior, medial to lateral. I've already worked the base of the big toe, so I only need to work where the toes are for those reflexes. Support your work again and work your inchworm line out. Support and just work right on that little line. Remember, 3 times is a charm, so we're going to do that 3 times. Now we're going to go to the back of the foot. This is what we call the dorsum of the foot. And we're going to start on the toes. This is the breast area, the chest. This is the more superficial areas, just like on your body. The outside, the top side is more superficial. So when I work the chest area here, I'm working on breast tissue and I'm working on the lymphatic system for the upper body. When I'm on this side, I'm working the deeper organs, the lungs, the heart, what's in the mediastinum. All of those organs are more on this side. Support your work, and you're going to start on the toes. Now once again, you're going to do them like you did under here. You can either do one individually or all at the same time, but you're not going to start on the nail. Push down so that they kind of flatten out, and you're going to start below the nail, and you're just going to do your little inchworm. It's easier to do fingers. It's kind of, see what you have to do to your thumb. Here, I'm going to do the same thing I did before. Remember, continuity. If I worked individually toes on this side, I need to do individual toes on this side. There needs to be continuity in your work. I tell you to mix it up a little bit, but not to where you're changing your style. So if I did them all together here, I need to do them all together there. So I'm going to work down. Now, in between the metatarsals, well actually these are tendons, you're going to want to do your inchworms in there, and you're going to turn your finger sideways, because what you're going to try to do is push them apart. You're not really going this way, you're trying to push them apart. So you're just going to go back and forth 3 times between each of those tendons. So that's the superficial chest. Now we're going to do the deeper chest, the lungs, the heart, everything that's in the mediastinum. Support the foot, and I like to reinforce my thumbs. It gives them a little more support. It's not so hard on them when I do that, but you don't have to. You can lay them side to side. Or you can do it with one hand, which will take you forever. If you do 2 hands, it feels more complete. So we're going to do our little inchworms, but we're going to start above, superior, and we're going to work inferior. So it's an inchworm, inchworm, inchworm. If the toes are dancing, then you're doing it right. You're going to come down, and you're going to do that all the way across the foot. I could have done just one, all the way over, come back, did one, all the way over, come back, did one, all the over. But you can see how that is a lot of moves, and you can complete what you need to do with fewer moves. It feels much nicer to the person. So I'm going to do 3 at once. and then move on. Okay? So we started with our desserts. We did the toes, we did the top, the deeper part, and we've worked on the upper body. After we do that, when we get through doing the lungs, we're going to do a lung press and a solar plexus. Remember, it's the same hand on the same side. So it's this hand that I'm going to put in there on the lung, the diaphragm line, and I'm going to push in and pull back, and push in and pull back. And it's this kind of movement that I'm doing. Then I'm going to do a solar plexus, which is a hook. Hook, hook, hook. So now we're going to go back and be a little more specific to a particular area up here, and we need to complete the upper body, which would include the shoulder. If you look at the little toe, the pad under the little toe, that skin is a little thicker, and it actually looks like a scapula. So we're going to come back and we're going to do a little extra work on the shoulder. And because we're trying to reach in a little deeper, we're going to use a hook. Now you may find something that we call crunchies in there, where there's been deposits laid down, and you want to do that several times in that area. To work the arms and the legs, it's just a pinch. So once I do the shoulder, I'm going to pinch down the outside of the foot. Run your finger down the foot, you'll feel a little bump right there, and right below it a notch. That's called the 5th metatarsal notch. The 5th metatarsal does not go all the way back to the heel. It ends right there. That is the waistline. So if I want to come straight across his foot, then I know that that's where the waist is. And I'm only going to pinch down to there. So I'm going to pinch, and this is for the arm to the elbow. Arm to the elbow. And that's everything for the upper body. Okay? We're going to do a little side to side, loosen up his foot a little bit, move your stool, do a spinal twist. And now we're going to work just the upper part of the arch of the foot. We're going to do the upper abdomen. Stomach, liver, pancreas, spleen, all of those organs are here. We're going to start medial, and we're going to work lateral, just like we did the ball of the foot. All right, so we're going to start medial, and we're going to go lateral. We're going to position our hands the same. We have to support. Reinforce your thumb or put them side to side, and walk over. So it's 3 stretches for each position. You want to try to make 5 lines, because reflexology is based on zone therapy. That there are 5 zones of electromagnetic current that's running through the foot, and you want to be sure that you make all 5 of those lines. Okay? So you're going to work your way over with your inchworm, medial to lateral, but only at the waistline and above. Waistline and above. Okay? Now we're going to hook an ankle, windshield wipers. Now we're going to come back and do toe rotations. Now remember, just like we began the first time we did them, we went from a hook and ankle position to a toe rotation. So it's the same move. I'm here and I have to go like this. This hand moves up, holds the instep and the solar plexus. This hand comes up and pulls the toes and rotates them. Base of the toe and rotate. Maybe you want to add a little shake to it, a little twist to it, whatever you want to do to make it feel nice and a little different. It's still going to be a toe rotation held at the base of the toe, this toe to that toe, but you can add a little something to it to make it a little more creative for the person. All the way over, it's up to you to end there or to come back. It feels more complete to come back from where you started, but that's kind of up to you. Now we're going to do the second half of the arch of the foot, which represents your large intestine, your bladder, your prostate, all that kind of stuff is there. And it's all according to which foot you're on as to what you do. If the structures in the body are on both sides, they'll be on both feet. But if you've only got one on one side, it's only going to be on that foot. For instance, your heart is going to be kind of in the middle, but it's more to the left than the right. Your spleen and your stomach are on the left and your liver's on the right. You don't have it on both feet. You don't have it on both feet. Now, where your small intestine meet your large intestine, and as it goes across the body, it's going to have one that's only right foot and one that's only left foot. So if you're working on the right foot, this is where the small intestine joins the large intestine. It's called the ileocecal valve. It's also a very good reflex for the appendix, it's right there, and for allergies. Don't know why, but this valve seems to stimulate or have something to do with allergies. So if you're able to work on this area, you can help relieve some of the allergic symptoms that some people have. If you look at the bottom of the foot, there's a darker, thicker skin across the ball, down the lateral edge, and on the heel. Where those two meet, heel, edge of the foot, in that corner is where you're going to find the ileocecal valve, because this is where it meets, and then it goes up, ascending colon, transverse colon, descending colon. So I want to use that point right there, and when I'm trying to reach a deeper surface and I'm trying to do more work specifically, it's going to be a hook. So I'm going to hook that point before I start. And then, just like I did upper abdomen, I'm going to come over and do the lower abdomen. So after I hook that valve, I'm going to come over and start my lines and move medial to lateral. This half of the arch of the foot includes the bladder. Now, the little pouchy, poofy thing that you see on your instep right at your heel, that's your bladder reflex. So I'm going to come all the way over to that bladder reflex to start my lines. So I have an extra line here on the lower abdomen. So I'm going to start here with my reflexes. I'm going to start on the bladder. Then I'm going to work my way over just like I did here and just like I did here. So you start with a hook, you go to the bladder, you do your lines with your inchworm for the lower body, lower half. Then we're going to do a rotating the ankle. All right, I stopped. I did my inchworms, and I'm here with my thumbs. And now I'm going to do an ankle rotation. This hand has to slide up and hold the instep, and this hand slides around to hold the heel. That makes my transitions feel very smooth. One technique to the next, one body area to the next, but it all has a flow to it. So lean back and rotate, pulling 5 times. Put your hand on top, thenar eminence, and push forward 5 times. That's an ankle rotation. It feels great. Now we're going to work the spine. Now this is the one area that we're going to reverse what we were doing. We're not going to work down, we're going to work up. So we're going to start on the tailbone, and we're going to work up to the head. The middle of the heel is where you want to start, and you want to start with a hook, but you got to support the foot. Remember, you're going to be working on it, so you got to support it. You want to turn it out so it's easy to get to. So I'm going to start my line with a hook like I always do. Support your thumb, don't use your thumb like that, and inchworm up that foot. Now you'll feel a little bit of a bone here, and you don't want to be on the bone, so be a little distal to it so that you're on the arch, you're on that plantar fasciitis, plantar aponeurosis. And just go all the way up, all the way up, all the way up to here. Do that 3 times. That's for your spine. Now that we've done the spine, we're going to come back and we're going to do a little side to side, the spinal twist, to open it up a little bit. And hopefully you will feel that their foot is looser now when you do this. When you come back and do this, you should be able to get a little bit more motion than you had before. Now to complete the lower body, like we did with the upper body, we completed that with the shoulder and the arm. We're going to complete this with the hip and the leg. Hips are appendicular, they're lateral. So you're not going to do hip on the inside of the foot, you're going to do hip on the outside of the foot. If you look under that malleolus right there, there's a little pouch of brown fat under the ankle, very soft. You're going to start there. You're going to do hooks into that area. That's for the pubic symphysis, the way the two hip bones connect together, the deeper surface. So we're going to start with that. We're going to pull, pull, pull. Do 3. Then we're going to come back and work the hip. The lateral surface of the hip is where the calcaneal bone is. It's right there. All 4 fingers, you're going to inchworm from here to here. So just inchworm. You're going to do that 3 times for the hip. The leg, you're going to pinch up to that notch. For the arm, you pinch down to the notch. For the hip, the leg, you're going to pinch up. So I just pinch up. Just pinch up right there. Remember, it's 3 times. Now I've completed the body areas. I'm going to go back and do something specific to the ovaries and testes and the lymph system. So a little loosening with the side to side. I need to hold the foot. So here I ended with my side to side. Drop that hand down. You're holding the foot. This hand is going to do the work on the heel. You can squeeze that Achilles tendon. Do that 5 times. Once you learn to do this, you don't have to keep using this little guideline to find it, but you're going to work ovaries and testes are lateral, uterus and prostate are medial, and it's a little point halfway between your ankle bone and your heel. So you're going to use your tall finger and your thumb on the heel, on the lateral malleolus, and drop your index finger down, and that's where it is. Medial, you're going to do the same thing. Heel, ankle bone, drop your index finger down. Now when you look at the structure, you'll see it's a little dip between the foot and the heel. You just want to hook both of them and just hook them. So you're going to pull them both at the same time. Then you're going to make a little bracelet walking up the ankle from either side. So from that hook point, distal to the ankle bone, you're going to start a little inchworm line and you're going to go all the way up. And you want to see skin pull. Pull that skin. That's for the fallopian tubes on women, the vas deferens on men, and the lymphatic system. That little bracelet. Now you can come back and do whatever you'd like to do at the end. You can add lots and lots of desserts here. Every one that you like, add them, throw them in, come back and do your side to side, your hook and ankle. Just always end with a lung press and a solar plexus. So once I've done whatever I'd like to do to this foot, maybe go back and work a little more on the shoulder. I found a little problems in the bladder area. They felt that was a little tender. I'll go back and do a little more specific work to any problems or conditions or something that I thought they would benefit from. And then I'm going to finish with the lung press. Remember, it's the lateral hand, match the toes, push up 3 times, and then solar plexus. Then you're going to put this foot down, bring the other foot up, do the same thing. Now on the left foot, you're not going to have a solar plexus. I mean, the ileocecal valve. Over here, what you're going to have is the start of the cecum, where the sigmoid flexure is, the start of the cecum part of the colon. So you're not going to be at the edge like you are on the right foot. You're just going to come to the middle, and you're going to hook. So on the left foot, you're going to hook right here, go over to the bladder, and do your lines medial to lateral, medial to lateral. And when you're done, you're going to put a nice warm towel on the feet. A lot of places where you work, they have really not gone completely as a therapeutic treatment, and most people get a foot massage. So you've got time at the end, and it's going to feel good and it's going to help them. You want to do a little bit of a foot massage. Now, with enough of the powder on, you really don't need to use oil, but you have to think about what your client is expecting, their expectation. So if I'm going to do a foot massage, I'm probably going to use some kind of oil. Go back and put some oil on, stretch out that plantar aponeurosis in case they do have plantar fasciitis. Loosen up the foot, work on all those muscles, give them a nice little 3 or 4 minute foot massage at the end, and you're done. And then you can put the hot towels on, and they should be done. The length of time you do just the reflexology treatment is 25 to 30 minutes. So most people, when they come in and book a reflexology treatment with you, it's not an hour, it's half hour. If they want the ritual where you clean the feet, then that would be an hour. You would book that for an hour. You, of course, can always upgrade. You can add aromatherapy to it, whatever else you'd like to do to make it more enjoyable or more beneficial to the person on the table. That is what you can do as a therapist. But the basic moves, that's what you're going to want to do, and then go from there.